We were actually talking when we were getting our soft. Hey everybody, it's Dr. Freels here. We are visit 3 on our ulcer. Sad news today, the stat bone scan that we ordered 2 weeks ago is not going to be ready for them to have done for another 3.5 weeks. So we are urgently looking for another company to get him in to make sure that his bone is not infected, as well as scheduling an infectious disease appointment at this time, because the redness is still staying there. He's on his last day of doxycycline, which you were on an antibiotic before you even came in.
Yes.
And then I put him on doxy, and then we had another one on doxy. So at this point, the oral's not doing it. Again, the bone scan is delayed for insurance and scheduling reasons. So let's see what's going on today. His lovely nurse over here was talking about how when she was cleaning it, this was coming off. And so she's just gonna let me clean all this up. The ulcer itself is looking better, much better.
I thought so too.
The problem is I believe that bone is infected underneath. Yeah, that's just, and what I'm thinking about doing, remind me, Katrina, is go ahead and contacting, once we get a clean scan, to see if we can't do a actual skin graft. Do it in here. We'll get it approved by the insurance ahead of time, but just to put a graft on, yeah, we got to look at this down in here. Oh, I'm gonna need some soft tissue nippers. Hang on. Excuse me. Who is your vascular doctor? Because the pulse on top of his foot's nice and strong, but we've got some swelling.
Well, I don't know if he's Timothy Winchester. He's our family doctor.
Family.
Yeah.
But a vascular doctor, no?
No.
Let's go ahead and get that squared.
I had to stop and think what you were saying.
Okay. So all this is just not attached. We don't want to leave on there in any capacity. You can kind of see it's a little juicy down in here. No purulent drainage. It's just a bit of serous drainage, which is good. That's the clear stuff. If we're going to have drainage, that's what we want. I remember the first time we did this, it was, woof.
Yeah.
There was a ton that came off. Get that little piece out of my way. So all this is just fibrotic tissue, that white glistening stuff. Fibrotic tissue actually serves as a barrier for good skin healing. So generally, we want to see, when dealing with this type of ulcer, good blood flow coming in. So I'm just trying to kind of get things roughed up. I don't want to go too aggressive. Yeah, it's still warm. We were actually talking when we were getting our soft tissue nippers, is it possible that he could lose his toe? Sadly, he's not responding well to oral antibiotics. I'm not saying yes, it's going to happen, but once we get some IV antibiotics and get that bone scan, come on, then we'll know exactly what we need to do. Because the last thing we want is that any type of osteomyelitis or bone infection spreading to any other part of the foot. If we have to take the toe, you can still function perfectly without a toe. We were talking about how getting him a toe filler, so it's a shoe. So if you've had your toe amputated, any of them, by the way, having a shoe that has a toe fill, which your insurance should cover, to help stabilize the rest of your foot, because the toes are going to start drifting. If that second toe doesn't have anything to stabilize and that big toe's gone, then it's going to start moving and shifting, and then guess what? We've just got more problems. So the toe fill's an easy solution. And I've seen several toes amputated and not have that filled in properly, and it just creates so many more problems. There's so much buildup on the end here. You're doing good wearing your shoe, right?
Yeah.
Okay.
He clomps around in it all the time. I can hear him.
Can't sneak up on you, can he?
No.
You doing okay, bud?
Yeah.
Okay.
He says there's no feeling in it.
Yeah. That's the problem. Is this ulcer war, and he didn't feel it.
Yeah.
Let's see what's going on in this piece here. Yeah. Oh, that. I don't want to get too much of a bite, but I want to clean up as much as we can. Are you guys going to be around the rest of the week? Because I think I'd like Dr. Carter to take a peek at it on Friday.
Yes.
It's just more red and swollen than normal.
Yeah.
I mean, it's the ulcer's looking better, but the skin itself is not.
Mm-hmm. That's what I thought.
I know my nose is running. When you lean over like this, it's hard to get your not. Everyone always comments on my nose running, and sometimes not in this case, but the odor is so bad. It's natural, right, for your nose to want to run. But I never want to say that, you know, on camera. It's like, oh, this is why. But leaning this way promotes drainage, so sorry about the sniffling. Okay, I think we got that. That's good. So you have been on antibiotics for how long?
Gosh, the cream. They gave him antibiotics for 7 days when we went first time to Baptist Health.
Yeah.
And he was on that for 7 days. And then we went to Dr. Winchester and he said, come here.
Gotcha.
And then you started it.
Yeah.
So, but this has been going on now for about, I guess, 4 or 5 months.
And you didn't see anybody for how long? Not you, but...
Yeah. I didn't even know about it.
That's right, I remember. You're a little stinker up there. Okay, good.
Never said a word.
So...
But it didn't hurt, so I guess that's why he never said anything.
That is an excellent comment, because this is why it's important to check out your feet on a daily basis. Just throw a mirror in the ground and then look at it just to make sure there's no holes. Because when you have neuropathy, diabetes, or neuropathy just for any reason, you're not going to feel it.
Yeah, I think that's...
Okay, Katrina, let's grab some more gauze.
Diabetic now.
So what I'm going to do is just cover it with some betadine. It's a little moist. It's a little juicy, not bad. And when we turned off the camera for just a second, this all started by him trying to trim his toenails. And do you have any idea how long it was there before you found out? I think it was at least 3 or 4 months.
Oh, yeah.
Yeah.
For sure.
So, but he didn't feel it, so he didn't, see it because it's on the bottom of his foot or his toe. So definitely checking out to make sure that there's nothing there that's occurred that you're unaware of. I mean, it would save a lot of this. I got a little bit left. You want that?
Yes.
There we go. Oh, again, nose running. All right, guys, we'll keep you posted. Again, hoping for a clean scan. I'm not super confident it's going to come back clean. But nonetheless, we will follow along, and you can see how dangers of having neuropathy and trimming your nails and not being able to see can end up slipping like this. All right, guys, thanks for watching.